Okay, it's 1:30. Welcome everyone. Belina Mai Kako. My name is Lindsay Iligan. Thank you for joining us today on World Elder Abuse Awareness Day. We're glad to host this educational workshop entitled Understanding Self-Neglect and Responsive Approaches to Care and Support. Again, my name is Lindsay Iligan. I'm the Kupuna Program Manager at the Hawai'i Public Health Institute and co-coordinator for the Kupuna Collective. I'll be your facilitator for today's training. Before we get started, I want to go over some Zoom housekeeping rules. One second. So all participants are muted upon entry today. For all questions, please utilize the chat box or Q&A located at the bottom of your screen. This meeting is also being recorded and will be shared on the Hawai'i Public Health Training Hui's YouTube channel. The slide deck and other supporting materials, links, and Q&A that may arise during today's webinar will be housed in a Google Drive folder that will be shared with all registered participants after the training. We'd like to thank the organizers of this training, Hawai'i Public Health Institute, Hawai'i Public Health Training Hui Steering Committee, the State of Hawaii Executive Office on Aging, and the Kupuna Collective convened by HIFI and the University of Hawaii at Manoa Center on Aging. We'd also like to mahalo our sponsors that made this training and continuing education credits possible. Mahalo to Ola Hawaii, a program at the John A. Burns School of Medicine, the Western Region Public Health Training Center, and the Public Health Training Center Network. Continuing education credits for today are chess, dietetics, social work, and substance abuse counselors and prevention specialists. To claim your CEs, you must register in and attend today's call and complete a post-training evaluation survey. The survey will be included in the Mahalo email following the call. Please submit your responses by next Wednesday, June 21st. Certificates will be mailed out no later than June 30th. Folks calling in, please email me at lindsay@hifi.org, including your name and phone number used today to receive the training survey. Without further ado, I'd like to hand it over to Cristina Valenzuela, who is the Legal Services Developer for the Executive Office on Aging, to introduce herself and our speakers.
Thank you, Lindsay. And thank you to everybody for joining us for today's webinar, Understanding Self-Neglect and Responsive Approaches to Care and Supports. As Lindsay said, I'm Cristina Valenzuela, Legal Services Developer with the Executive Office on Aging, also known as EOA. EOA is the lead agency in the coordination and oversight of a statewide system of aging and caregiver services and supports for Hawaii. Before we start with the presentation, I'd like to just first acknowledge and thank Kupuna Collective, UH Center on Aging, and of course the Hawai'i Public Health Institute. Mahalo nui to Lindsay, to Makamai, and to Christy for the great collaboration and coordination for this webinar. So as we grow older, we all deserve the opportunities to be able to engage in our communities and to be valued members of those communities, free from threat of abuse, neglect, and exploitation. But unfortunately, data shows that, I'm sorry, Lindsay, can you move the next slide? Sorry. So unfortunately, data shows that an estimated 5 million or 1 in 10 older Americans are abused every year. And according to the Department of Justice, only 1 in 24 cases are actually, cases of abuse are actually reported. So today, as Lindsay said, June 15th is recognized as World Elder Abuse Awareness Day because public awareness is really critical in the prevention of elder abuse. One thing that I hope that you take away from this presentation is that we all can help to prevent abuse from happening to kupuna and to vulnerable adults. Last year's event talked about financial exploitation. So there's many forms of elder abuse. And this year we're focusing on self-neglect. Elder self-neglect is a more prevalent problem than most people recognize. And data also shows that self-neglect is actually a very common form of abuse. But unfortunately, because it oftentimes occurs in someone's private home, we don't often see how big a problem it is, or vulnerable adults who are more isolated, so we can't see how big the problem is. To share their knowledge and expertise on self-neglect and the role of Adult Protective Services, we're fortunate to have our two speakers, Sharon Adric and Paul Needham. Next slide, please. Sharon Adric began her social work career with the Department of Human Services Child Welfare Services branch from 2003 to 2016 as a social work investigator, case manager, and supervisor. In 2016, she began her career serving the vulnerable adult population with the Department of Health Developmental Disabilities Division as the compliance section supervisor, overseeing the DDD Adult Foster Home Program and the Division Complaints and Informal Reviews Office. In February 2020, Sharon returned to the Department of Human Services Social Services Division as a lead trainer for the Adult Protective Services, Adult Protective and Community Services branch. Next slide, please. We're also fortunate to have Paul Needham. Paul Needham is the owner-operator of TCS Services, and he's worked in the field of adult protective services and domestic violence for 43 years. Paul retired from the Oklahoma Department of Human Services Adult Protective Services in 2015 after 36 years of service, where he received several awards for quality and excellence. Paul also served on the Oklahoma State Council on Aging and Adult Protective Services and the State Ombudsman Advisory Committee since 2015. Paul is the chairperson for the NAPSA, the National Adult Protective Services Association Education Committee, and he's also on the NAPSA's board of directors. Over the years, Paul has trained thousands of professionals and paraprofessionals, including at state, national, and international conferences on topics related to adult abuse and domestic violence. Paul's been married to his wife, Mary, for 44 years, and they have a beautiful daughter and wonderful son-in-law and 3 amazing grandsons. Paul is an avid hiker, backpacker, and hunter, and enjoys spending time with college students at his church, where he serves as the college minister. Sharon and Paul, thank you so much for being here today to recognize World Elder Abuse Awareness Day and for sharing your expertise on elder abuse, especially on self-neglect. Sharon and Paul, please take it away.
Good afternoon, everyone. I'm just going to wait to take control over the screen. Well, happy World Elder Abuse Awareness Day. So this is actually going to be the focus of today's webinar, and understanding self-neglect and responsive approaches to care and supports. I'm pleased and very happy to co-train this module with Paul Needham. I actually just got off a training with him just a couple weeks ago, so it's always exciting and fun to do trainings with Paul, and I'm glad he's actually here. So, and we have a backstory to that. So
There is a
barely
story.
made it here. We do have a backstory to that. But again, thank you to Christina, and thank you to Lindsay and the Kupuna Collective for just having us be part of such an important day. So, people who experience self-neglect typically engage in behaviors threatening their health and their safeties. So as cases of self-neglect often come to APS when a person refuses to fails to provide themselves with adequate food, water, clothing, shelter, personal hygiene, and prescribed medications and safety precautions.
This training was really kind of a product of a combination of things. The National APS Association's Education Committee helped create a good part of this, and NAPSA is a wonderful organization, as I think. As the chair of the Education Committee, I've been blessed to be part of a national APS family. But let me tell you this, from me to be here with you all today, there in Hawaii, it is an honor. I whether I know you or whether you know me or not, I love you. I think you're amazing. Um, some of the best people in the world. And I've been blessed to meet a lot, but truly blessed to be here with you. Just so you know. And the workshop we're going to do here, you can read. So I hate reading to adults, but the workshop we're going to do here today is an awareness workshop. We don't get into a lot of detail, but it is an awareness workshop. You can change the next one. Okay. These are the entities that helped, that a lot of this training came from: the National APS Association, the Education Committee, APS Workforce Innovations, ACL, and the Voluntary Consensus Guidelines, and the National NCEA, and then my own Oklahoma Department of Human Services that I worked at for 36 years, retired 8 years ago. So parts of this is from that self-neglect training created in that training. Sharon?
So the target audience for this training includes anyone who routinely encounters elders or persons with disabilities. So this can include our law enforcement, faith community, other communities, the medical community, hospitals, hospital social workers, medical ERs, EMT, first responders, anyone in home health, nurses, in-home services, the aging network like the Ombudsman's office and senior centers, anyone who works with individuals with vulnerable adults that have disabilities, and schools with classes, especially with young adults with disabilities, alternative types of schools, our mental health community, and our financial community. So let's take a look who's actually in this audience. So Lindsay is going to actually pull up a poll for everyone. She's going to take back control over the screen and tell us who you are.
Oh, cool. We do have law enforcement with us.
Yeah,
At least there's at
lots
least
of
one,
people in the
two,
medical communities.
a lot.
Oh, let's scroll down to the bottom. There's my APS people. Hello, my friends.
Well, I'll speak to law enforcement. I know we got two of you all here, two of you guys, gals here. I will tell you just briefly without any backstory, I owe you a debt that I cannot repay, and it was a life-saving threat. So, a life-saving debt. So, you guys, gals, and law enforcement have my heart. Obviously, I love APS. Really glad to have the medical community aging network, disability network here. We don't have someone for disability, but we do have a lot for mental health as well. All right, she's going to end the poll and we'll see what we got. All right.
Lots of people from the medical
3
community.
law enforcement. Yeah. And 77 from the medical community. If you would, I'm just curious. We can save the chat later, and I'm not going to be looking at chat, but you might put in there, if you're in the medical community or law enforcement or mental health, put in what your genre actually is, what your immediate area of interest is. I'd be, as a trainer, I'm being curious to know. Well, thank you all for being with us. The pictures you see of Hawaii, as mentioned earlier, I do like to hike. And some of them are from Oahu. That is Crouching Lion, as some of you know, on Oahu. They're on the northeast side, and the view of the bay from part way up Crouching Lion. The background on my screen for me is Kalalau Valley in Hawaii. Some of you may be familiar. All right. All right, we go. There we go. I don't like reading to adults. Y'all can read that for yourselves. But the true goal of today is to provide an awareness, an overview of self-neglect. And in particular, going to share some particulars about Hawaii as well. Sharon will be helping with that. So if you would, should we have them enter it in chat or into actually into the what was it we asked him to write
The
questions
Q&A.
in? The Q&A. You can do either one. But what you would like to achieve, probably write in the Q&A if you would. It'd be nice to capture that. I'm not sure I can see oh yeah, I can. Okay, if you'll take the time to do that, it'd be nice for us to see what it is you actually know, and we'll try to cover as much as we can. Okay.
We got how to help without offending.
Yeah. Good point. Question or request. Increase awareness. Public guardian. Oh, I see. Some of you are putting who you are. Hear current information and practice for elderly who may be neglecting themselves. Okay. Just learn about it and who to contact for help. We will do that, Mary. We'll certainly do the best we can there. When the person doesn't want help and will refuse help, how do we help? How can we help? Great question. Great question walks in. And I hope we have time to address that appropriately. There is a section here that we'll do we'll at least share some thoughts about that, Roxanne. What is the definition of self-neglect? That will definitely be in here. Lindsay says how to encourage those who refuse help and services. There's a theme here about how do you help those who don't want help. A very common thing for adult protective services as well, when we go out on these cases. How can caregivers connect to resources? And I'd like to learn ways to tell if a person is self-neglecting. I don't see them face to face. That can be tough, Jacqueline, because it's really easy to hide it if you're not actually there present. Say, oh, yeah, there's a lot of they can gaslight you pretty good if you're not there. They can tell you everything's fine. And it goes to your family members who aren't nearby. They can tell you, oh, everything is fine. Yeah. Researchers connect. And just wanted to see your Deidre. Just wanted to see smiling face.
Hi,
Deidre,
Deidre.
You're a mess. All right. I love you too. All right. That was enough of that. Let's go on.
Yes.
All right. Here's our training objectives. Again, they're on your screen. You have your handout. I know you can read those. So I pretty much refuse to read to adults. I don't like reading straight off the slides because I figure you can read. And if that's all we do, then you go, why attend the webinar? Because I could read the PowerPoint. But one of the things that we hope to do here is there's more here than a full day of training just on self-neglect. There's a half a day training, at least a half a day training on hoarding and ethical issues surrounding hoarding. So we're going to focus on the basics and on the definitions as was requested, and on dealing with those who are reluctant to receive our help. We will be visiting a little bit about that. Okay. The guiding values. it really is about two things, and I highlighted them here. And it goes to the point that many of y'all made in the chat. How do you help someone who doesn't want your help or who is refusing help? And the bottom line is safety and self-determination are equally important. But when we're talking about adults, we have to understand that self-determination will always win over safety, even over safety, as long as they have the capacity to understand the consequences of their decisions. We'll visit more about that in a little bit. But safety and self-determination are absolutely equally important. But under our law, and rightfully so, people have the right to decide whether they want help or not. It goes to many of the questions that even if it means it may cause them serious harm, even the point of death. As long as they understand that and they know that, self-determination will win. The other one that speaks to some of the questions earlier is about people should be treated with honesty, caring, and respect. And as Sharon knows, and many of you know in your professions, whether it be law enforcement, medical, or mental health, or others, respect is the key factor. It really is. It is the one thing that can break down the barriers, in my experience. And it's that, and it does help us not leave them behind. All right.
All right, the principles. So as APS, in our APS programs nationwide, these were based on principles to not just to protect the rights of their clients. This includes the right to be safe, the right to make lifestyle choices that others don't agree with as long as they don't harm others, and the right to refuse any and all services. Paul just kind of went over that in the last slide. And APS will respect the client and the client's civilization and their constitutional rights unless that client, again, lacks decisional making capacity. Then they're seeking guardianship or some type of conservatorship, or the court has adjudicated that otherwise. So this definition of vulnerable in Hawaii. So part of my role as the APS trainer in Hawaii is to provide mandated reporter trainings for our community. And one of the first definitions that is reviewed even before going into the types of abuse APS investigates is this definition of a vulnerable adult. So when a report comes in to the APS reporting line, the first thing that the intake unit must determine is whether this person that you're calling about meets this definition. So this is the definition. A vulnerable adult in Hawaii means a person 18 years of age or older who, because of a mental, developmental, or physical impairment, is unable to do 1, communicate or make responsible decisions, to manage the person's own care or resources, to carry out or arrange for essential activities of daily living, or 3, protect oneself from abuse as defined in this part. If information is not provided to meet the definition, then the APS intake worker will ask if there are any collateral contacts, such as maybe a doctor, a family member, or a neighbor, so that we can obtain more information that this person that you're concerned about meets this definition. So self-neglect is actually one of 6 types of abuse APS investigates, and this is probably one of the most difficult types of abuse for APS to accept because it has to meet this definition. That the vulnerable adult is unable due to a physical or mental impairment, or both, to perform tasks essential to care for oneself. 2, appears to lack understanding or capacity to make or communicate responsible decisions. And 3, appears to be exposed to an immediate risk of death or serious physical harm. So all 3 of these definitions need to be met. And a lot of times a call will come in and the person is clearly vulnerable, clearly in a very imminent situation, a very bad situation. But if we don't have the information from the complainant that there is anything that indicates a lack of capacity or cognition, then it would not meet this self-neglect criteria. Now, what we don't expect is for the community to know whether or not this person has capacity, or which is another definition we'll go over in the later part of the slides. But the APS intake worker will probably ask you, have you noticed a change in the person's memory? Are they more forgetful? Maybe they're not paying their bills, or their electricity got cut off, not remembering to eat, they're losing weight, or wearing the same clothes. Something has changed in this person's cognition and capacity. So we like to give you a little bit of numbers, a little bit of stats for you all. Here in Hawaii, this is from fiscal year 2022. We had a total of 631 cases that were accepted for investigation. Self-neglect cases was comprised of 17% of that, 130 cases. This is not the highest number. The highest number of cases actually accepted were for caregiver neglect cases.
So as Sharon was talking, it did partly address in time with the time we have the question that Anonymous asked about what the definition is, and that is actually the legal definition in Hawaii. And I love that about APS. The work that we do is actually codified. The directions we have and the mandates we have are actually in law. And that's the true, whether it be in Hawaii or North Dakota or Florida or Oklahoma. The other part of what Sharon just addressed was one of the questions, I think it was Sandra, about the criteria that APS needs to act. And that was specifically on that slide, Sandra. Hopefully that helped a little bit. Indicators, and that's, I can't remember who asked it or who mentioned it, either in chat or in the Q&A. But here's some of the indicators. Obviously, this it's not all of them, but lack of medical care. Hoarding, of course, can be an issue. It's not the biggest issue we face, but when we do face it, it's a huge problem. It's not the largest by any means, the large part of our population base that we, in a caseload that we work with, Hawaii or nationally. Poor hygiene probably fits a lot of the areas that we deal with. Squalor can be. Sharon already mentioned dressing inappropriately for the weather. I know your your weather in Hawaii is awesome. I love it. My wife and I love coming there. It's her favorite place to go in the world. But someone wearing, it's 75 degrees outside and they're wearing winter apparel or nothing at all, that could be an indicator. Financial issues, non-payment of bills, past due bills, eviction notices can be an indicator of self-neglect, the inability to care for their finances. So these are some of the areas that we work with. Some of them get very specific when it comes to squalor, like even things like animal feces in the home and things of that nature. Law enforcement, you and Adult TCS Services go into homes that for the most part nobody else sees. So we're going to look at the 5 domains, assessing self-neglect in 5 domains, and you have them on your screen. We're going to start with psychological. And when it comes to psychological, you have self-neglect. There's not one specific personal characteristic. There's mental illnesses, of course, but there's substance abuse. There are parents and grandparents at the mercy of substance abusing children and grandchildren. And there's some things that Hawaii and Oklahoma have in common, and that is a large number of grandparents raising grandchildren. And that's a good thing, I think. I love so much of the family structure there in Hawaii. I know that a very good friend of mine, Lisa Amador, I know that her family lives on this piece of land, and there's the house at the top of the hill, middle of the hill, and the bottom of the hill. And the older generation lives at the bottom, the middle one lives in the middle, and the youngest ones live on top, and then and they're all there together. And it's a wonderful arrangement. But in many cases, there isn't the middle, and you literally have grandparents raising grandchildren, and there can be issues. Then you have the hoarding disorder per the newest version of the DSM-5. Hoarding disorder was never identified as a psychological diagnosis until the DSM-5s came out. The DSM-4s did not have that. data from Department of Health and Human Services indicates that approximately 25% of all adults over 50 need assistance in one or more activities of daily living: bathing, dressing, feeding, things of that nature. And approximately 50% of people over the age of 80, and I'm getting there, a few years away, require such assistance. Many people are fortunate enough to retain most of their mental capacities and self-care abilities, even when their physical bodies are deteriorating. They can direct their care. And they make do. I'll have an example of that later.
All right, so the individuals who use substances. So when we're exploring mental health factors, that's going to help us determine if someone is experiencing self-neglect. So we should consider these indicators, for example, substance abuse. So this is a common mental health issue, and asking questions such as, have you ever felt you ought to cut down on your drinking? Have people annoyed you by criticizing your drinking? Have
No.
you
Oh, sorry.
have you ever felt, or not drink at all? Have you ever felt guilty about your drinking? And have you ever had a drink in the morning to steady your nerves or get rid of a hangover? Now, it's not the role of APS workers to diagnose, but rather to observe these type of behaviors. And indicators may suggest a concern about the impact of just the mental health issues or their substance abuse issues on the client situation, even when there's not a diagnosis. It's important to know. So here's some indicators and behaviors to observe. So prescriptions, pharmacy hopping. If the doctor prescribed it, then it's okay. You can't remember if they took their medication or not. Over-the-counter medication, you can't get alcohol, so you'll pick up a bottle of NyQuil or some other type of cough medication in order to get that alcohol. And this also includes unknown consequences of the interactions with the medication they're actually prescribed with, or any type of homeopathic remedies. Or using your neighbor's medication, your aunt or your grandmother, stating, hey, Lois had a bad back, sore throat, earache, whatever it is. And so she gave me some of her medication that her doctor has prescribed. And even huffers, this is still something that happens, the ones who can get a hold of aerosol cans, etc.
I wouldn't be surprised if many of you have seen the situations when we talk about, we said neighbors' medications, but quite often it's family members gaining access to a family member's narcotic medication, pain medication, highly one of the more common forms, and it's not self-neglect. That's neglect or abuse or financial exploitation, but it can look like self-neglect.
This is you.
Oh, it's me?
Yes.
Yeah, of course it is. That's why you're so silent. Okay. These numbers that we're looking at here are pre-COVID. I know anecdotally, and I think many of you do too, we have a large number of mental health professionals, and you could probably speak to this much better than I could. But the prevalence of, let me just put it this way, the prevalence of mental illness in this country is a lot bigger than I think we realize. And especially when it comes to our elderly, because they so often don't get diagnosed with depression. Well, of course they're sad. Their spouse passed away. It's not just sadness, it's depression. My mother was after my dad passed away, the doctor was very bright, and started her on a sleep medication. And when the doctor was reviewing her medication with her, where a nurse was, says, "Oh, I see you're taking an antidepressant." And she goes, "Oh, I didn't know I was depressed." So it was working. The elderly population, and not just the elderly, but our disability population, often do not get diagnosed properly. They really don't, unfortunately. So we end up with people with untreated mental illnesses. Many of our APS clients exhibit symptoms that appear to indicate mental illness, especially depression or anxiety disorders. The self-neglect study by NAPS found younger self-neglectors were more likely to have a diagnosis of mental illness than older self-neglectors. That's where my diatribe came from a while ago. 67% exhibited symptoms of mental illness, but only 22 had a mental illness diagnosis when it comes to our elderly population. Some of the specific areas, and I will not read these. I'm not going to read the definitions, but there is depression, paranoia, schizophrenia, delusions, bipolar disorder. I will note that in people experiencing having delusions, that could be life-threatening. There's a lot more to that. Obviously, I said this is a full-day training, but delusions can truly be an indication of some life-threatening health situations going on and should be addressed immediately.
So now we're going to go over the next domain, which is physical and medical. And starting off with people with untreated medical problems. So these could range from the fairly obvious, such as the visible things like untreated wounds or broken bones, more insidious medical problems like nutrition deficits and diabetes. The NAPSA study also found that 25% of self-neglectors fail to obtain treatment for known disease. So it's also important to consider these untreated medical problems and mental illnesses separately, since they often are found together, and untreated medical problems may at first look like untreated mental illness. One part of an APS evaluation of a client is a determination of the client's personal decision-making capacity. So some important factors to consider in this determination are the client's orientation and to person, to time, to place, and the short and long-term memory. So Wendy Letzbader, she is an author and she frequently speaks at our national conference. She points out that APS workers should be very aware of memory loss and some dementia-like states that can be the result of very treatable diseases or would that cause some type of physical and mental disorder. Now, we're not certainly not saying that APS workers should try to diagnose problems, as we mentioned earlier, but you do need to be aware that something that has the appearance of dementia may be something quite different, actually. So grandparents at the mercy of substance abusing children or grandchildren, these situations can result from any of these emotional dynamics, the feeling of not wanting to sever their family ties, that they have a connection with their families, the fear of retaliation for the failure to, for that failure to cooperate. The adult child or the grandchild moves into the elder's home and the elder doesn't want to leave. They hope that the situation will get better. They need the care on their part. And the elder decides that they want to protect their grandchildren from these abusive parent, and they still feel responsible for the behaviors of their adult children, embarrassed that they raise these quote unquote failures. So the belief that the elder deserves poor treatment because they were such a bad parent themselves, the elders and their own substance abuse issues and their lack of awareness of what's going on.
We're going to lump these last three areas together when it comes to self-neglect, these domains of social and cultural, financial, and living environment, just for the sake of time. I want to warn you about this next few slides. There are some very graphic photos that we're about to present to you, and I apologize for that. But as many of you know, in the medical field and in the mental health field, and the law enforcement area, things aren't always pretty, and life's not fair. I wish only one bad thing could happen to any one person at any given time, but unfortunately, things can be very compounded. You can be abused and neglected and self-neglected at the same time. So when it comes to conditions mistaken for self-neglect, some of those could be poverty, eccentricity, unconventional lifestyle. It could be trauma. I think neglect by others is often misinterpreted as ends up looking like self-neglect. And low health literacy, which we don't have time to really go into, but it's a huge area. And that's really unfortunate because we have a large number of medical field here. But people who I'll just mention it here because we don't have a slide for it. And that is with low health literacy, that means the doctor sends them home with these medications and they don't even really understand what they're for or how to even take them. I knew as a brand new APS worker a long time ago, 44 years ago, I didn't know what BID and TID was. I want to give you an example of an unconventional or eccentric possible lifestyle. This isn't the exact home, but this is very, very close to a home that I went to in rural Lincoln County, Oklahoma, years ago on a Friday afternoon. And literally the house looked like this. It looked like nobody would, if you drove by on a country road, you'd think nobody lives there. But in fact, there was someone there. And she was an elderly lady. She pumped her own water. She still lived in a house much like this. When the sun set in the west, you could literally see the light shining through the home to the front side. And she heated the home, and it was cold. It was late fall or winter, and she heated the home with 2 wood stoves. One was the old Army wood stove that she cooked on and heated the home, and then she had in the bedroom, let's pretend like that window right there that you see, it would have been on that side of the house. On that side of the house was her bedroom and a small pot-bellied wood stove. Now, if any of those had malfunctioned, the house would have gone up like in a flash. But that's how she'd always lived. And she was fine. She didn't have transportation. She didn't have any way to get her food, her firewood and all that, but she had 2 relatives that provided all that. She directed her own care. She directed what she wanted them to buy, and she needed firewood, and they did a great job of doing that. Unfortunately, I don't remember how we got the call, but the fact is, both caregivers ended up in the hospital at the same time and didn't know it. It ended up okay, but the point I want to make here, I mean, she ended up being very safe, and everything worked out after that. And she continued to live in that home for 3 or 4 or 5 years later. But the point here is an unconventional lifestyle. Most people say, "Oh, nobody could live in the house; it wouldn't be safe." It was like, now the building wasn't falling down like this one is, okay, but it looked a lot like this. But she was perfectly fine. She'd always lived there. She knew how to manage that location, and she was perfectly safe right where she was, as long as she could continue to direct her care, and she did. Most people say, "Oh, APS should do something about that," and the answer is no. I want to mention briefly before we pass to the next slide the idea of trauma and neglect by others. This is something it's not part of it's kind of it's an anecdotal thought of mine that there's no research for, and I really want it. That is, when it comes to self-neglect, I truly believe that there are a significant number, Sharon, of our self-neglect cases across the country that are the result of abuse and neglect or financial exploitation. And now they don't trust anyone, so they don't want to let anyone in. They don't want anyone to help care for them. And now and we mentioned those who 25% at the age 60, 65 and over need help with their ADLs, activities of daily living, and 50% of those over 85 do. And yet they don't want any help. They won't accept any help because of their lack of trust, because that trust has been broken. I hope that makes sense to y'all. It does to me. And I desperately want to study down on that. Sharon? Sorry about the photos, guys.
Sorry about the photos. For those of you who have been in our mandated reporter trainings, this photo might look familiar to you. It's a great example of some type of self-neglect that happens here. This has just happened in our backyard. This is actually stage 4 skin cancer. This gentleman was a homeless individual who I'm going to call Uncle Bobby. He lived in the Sand Island area, and prior to APS getting involved, he was very well known to the homeless outreach community, the Honolulu Police Department, mental health workers were trying to intervene, and despite any type of intervention, he refused. So by the time APS got involved, he actually looked like this, and obviously the reason we got involved was due to him not understanding the consequences of not seeking medical attention. His reason, here where's the mental illness comes in part, is that he actually thought this injury was caused by being shot in the head by a midget. This is what he told our police department, the APS investigator. He was taken to Queens Hospital, and a petition to court for guardianship was actually filed, but unfortunately he actually passed away before a guardian could be appointed. This might look familiar to our neighbor island workers over in, I believe it's in East Hawaii, but this is another type of self-neglect situation. Again, on our islands, a hoarding situation. We can do actually a whole workshop on hoarding and the causes and, the indicators and how to, how to intervene. But yeah, just another example of a self-neglect situation on hoarding.
This is my house without my wife. Okay, just saying.
Okay.
Capacity, I know it has a lot to do with your questions in the chat and in the Q&A. And I hope we're getting to some of the issues that you discussed there, and especially the number of issues that talk about what do we do when they don't accept our help? How do we help? Obviously, one is when they don't have capacity. In the case of the gentleman, they try to gain guardianship, but usually that, and I think there's this misconception that that's what APS does. But quite frankly, we only get guardianship in 2% of our cases, at roughly speaking, give or take a few points. But when it comes to capacity, it involves memory, logic, the ability to calculate. Executive function is what happens in the frontal cortex, and that is, to me, is one of the critical elements of capacity. The ability to sequence, the ability to understand right from wrong, and what's appropriate, what's not appropriate, like walking outside without your clothes on and not realizing that that's not okay, or doing other things that's not okay. But the executive function is a huge, to me, and there are great tools for this, to understand executive function in individuals. But the misconception is that what we do is take guardianship a lot, and that is simply not what we do. We will talk about capacity because it is a critical element. And really nationally, it's not something that most of our clients have capacity. And there it goes to addresses the questions you all have in the chat and in the Q&A, is how do we help those who don't want our help? It is true that of 500 self-neglecting clients in this study by Dr. Dyer, and unfortunately she passed away a year or so ago during COVID, not because of COVID. She did pass away, unfortunately. A great doctor out of Texas. But this study that she helped do back in 2007, that out of 500 self-neglecting clients, half of them did score poorly on mental health tests. But just because you score poorly on a mental health test doesn't necessarily mean you don't have capacity. It may be diminished, but doesn't mean you still can't direct your own affairs and know the consequences of your decision. That's a problem. When it comes to deficits in mental health function, which is the next slide, their alertness and attention, their ability to process information, the ability to modulate their mood effect, and that's what I was talking about earlier in the executive function, that ability to properly respond to stimulus. someone says, hi, Paul, I hope you're having a nice day. And I end up being euphoric. Oh, thank you so much for, okay. That's a little over the top. You might admit. This is why Sharon loves training with me, because she never knows what I'm going to do. But that would be an example of a person's inability to modulate their mood effect based on particular stimuli that comes in. But information processing is that sequencing. For example, it's a pretty good indicator of lack of executive function when someone doesn't put their clothes on properly. The underwear are on the outside, okay, instead of the inside. Okay, that would be a clue. Most of you probably wear them the way most of us wear ours. I hope all of you do. Otherwise, I'm concerned. When it comes to information processing, that does also deal with short and long-term memory, the ability to understand and communicate, recognize familiar objects and persons, but most importantly is executive function. Deficits in thought process, and the fact that they don't have any delusions about the situation. For example, the gentleman that Sharon talked about, who said he was shot by a midget, I believe you said, Sharon?
Yep.
So, yeah. That was a delusion or hallucination, intrusive thought that he had. The inability to modulate mood, we've already talked about. Euphorias, even anger, or even anxiety, which is, again, it's okay to have anxiety. It's okay to be angry. It's okay to be happy. But we have social norms that say that's a little bit over the top as far as anger or euphoria or anxiety. Capacity consent really is the key issue here. Their ability to understand their personal limitations, understand what the risk is, understand what resources are available to them to address the need. And obviously the gentleman did not understand those things. He didn't understand his personal limitations in diagnosing his situation or understand the risk to him as a result of the stage 4 cancer. He also didn't understand what resources were available to him to address that issue. And he certainly didn't understand the consequences. And to me, that's the clearest definition of someone who does not have capacity to consent and a self-neglecting client. So basically, we're talking about decision-making capacity. Okay.
Okay.
Hawaii's definition is exactly this, and she's gonna let me read this slide.
Go ahead.
It's and when I look at law, I don't paraphrase. You've noticed me already. I paraphrase everything and I go off script. Not here. This is the Hawaii definition of capacity, the ability to understand and appreciate the nature and consequences of making decisions concerning one's person or communicate those decisions. So it includes the lady I visited about earlier who lived in the wooden house. She was still able to communicate what she needed, decisions that need to be made as far as her health and her food and her heating and all of that nature. So
You know, as I mentioned earlier in the beginning of the presentation, as we're going over the self-neglect definition, of course, meeting that vulnerable adult definition. The second one is capacity. So, and the third is, they're in immediate risk or death of serious harm. So a lot of times, these cases will come in and they're clearly vulnerable, clearly in a really bad situation, like Uncle Bobby, but not specifically that. But if we do have cases where there's no information of this person's lack of capacity, then, we would probe some questions about this person's cognition. So, but if capacity is an issue, at APS, if there's concerns or anything questionable about an individual's cognition, APS workers will attempt to get this person's capacity assessed. We're not trained experts to determine capacity. And also, I want to note that based on our HRS, these individuals, the only individuals that can determine capacity is a psychiatrist or a qualified physician. If we are already involved in an investigation and if we discover that this person does lack, they have indicators of lacking capacity, then we'll have, we'll attempt to petition the court for a guardian to be awarded to oversee this vulnerable adult's need to make all decision. And we're going to go in, and this is important to know as we're going through the interventions when working with clients suffering from self-neglect. So that goes on to actually our next part, which is the types, working with the clients suffering from self-neglect. The types of interventions, that we have: support services, mental health, involuntary interventions, monitoring. These slides are pretty straightforward and maybe things that you've already been doing as direct service providers, with the friendly visitors, telephone, support from the caregivers, money management, caregiver services, even case management services.
My hope here is that many of you have the question, what do we do when what can we do? And we're going to scratch the surface with these slides as Sharon goes through them, but hopefully it'll trigger your brain, says, well, okay, well, how do you do that? And maybe that'll trigger further conversation about, well, how do we do crisis intervention? How do we do certain things? Sharon?
Yeah, so with mental health treatment, psychiatric medication, again, group counseling and any type of crisis intervention. So when we talk about involuntary intervention, these are things like the assessments from the hospitals here in Hawaii. It says protective custody here. We do have, the in order for immediate protection that we can file. This is it's very similar to a restraining order to stop something from happening, freeze bank accounts, remove a perpetrator from the home. Again, we talked about appointments of guardians and surrogates, looking at mental health assessment, mental health guardianship, or MH1s, different types of involuntary intervention if this person lacks capacity. So, and this might happen more, with the removal of animals and control workers and any type of health and safety regulations, interventions that are involuntary. And as APS workers, we want to monitor, we want to check in on the client, whether it's formal or informal monitoring, documenting whether they see any changes in this person's care or they recognize any changes in their behavior. So Paul's going to take us into what APS can do.
I think that last slide, I'm hoping y'all that's how we talk in Oklahoma. Sorry, there's you guys, y'all, and all y'all. But I'm hoping that last slide that you talk about workers, talk about monitoring. Really, one of the keys to help is a lot of self-neglect happens in isolation. And if we can stop the isolation, get more people involved in the home with the individual that they wish, can be a huge help. It can help prevent them or keep them from continuing to self-neglect, or even help change behaviors that are harmful to them. Because the isolation can be the biggest factor as far as them continuing the self-neglect. So what can APS do? Look at not just the self-neglect, but what else might be causing this situation? Is there also caretaker neglect going on? Is there financial exploitation going on? Collaborate with the adult to maintain their independence. One thing that we all know, none of us like to be told what to do. Not you, not me, not any of us. And it's hard, well-meaning, but hard not to want to tell someone what to do to fix their situation. And there's so many possibilities in self-neglect from that we already mentioned in the indicators earlier. But to help them develop a case plan, advocate with other agencies, and arrange for in-home services with the approval of the client, of course, but help them see that they do have options. Sometimes the self-neglect comes because they don't realize they had options. They didn't know there was support. They didn't know their family did care. They didn't know that they didn't know about the resources available within the community to get food or medication or medical treatment. So, or even financial assistance. So just helping them see a future, a different future than what they have right now, by collaborating with them. And I think the key word earlier was respect. And understand that we're there to help them maintain their independence. I think that's one of the biggest things, and Sharon would agree, that Adult Protective Services deals with, is we go in to homes, and most of the elderly folks or those in the aging or those adults in the home that we go see from 18 and up, most of them think that what APS does is get guardianship and put people in a nursing home. So we're already behind the 8 ball. We're already way behind. And that's not what we do. So part of this collaboration is to tell them, we are here for you. If you're the one helping the individual, I want to help you be safe and maintain your independence in your home. That's a key aspect of how we can do what APS can do. Motivational interviewing is simply picking up on what they want to do and avoid arguing with them. Roll with the resistance. Develop, if they say, well, I'll go down and get me, get this amount of food and do this and do that, and I'm gonna go to the store. I'm gonna go to my dialysis appointment 3 days a week. They don't have transportation. Well, I've done it before. I've always done it, but the discrepancy is that's why we're here. They're not doing that. So how can we help you get there, since that's why we're here? You don't have proper food in the home. You don't have this, and that's okay. So, but how do we help you get the help that you need? Sympathy is a good thing. It's not wrong. Empathy is a whole lot different, and that's a whole different training as well between sympathy and empathy. And that's in part of a communication module. There's actually, by the way, there's 23 different core modules that Adult Protective Services workers have for training aspects for their jobs. And one of them is professional communication, and the empathy and sympathy thing is in there. So that's a whole day of training right there. When it comes to what APS cannot do, we cannot force clients to do what we want them to do. If they have capacity, they have the right to do. So it's better to go with the flow and win small victories, help them win small victories in their self-care, than to go in and say, we're just going to tell them what to do. It simply doesn't work. By the way, it doesn't help when I tell my wife what to do either, just so you know. Doesn't work real well. And that's okay. APS cannot involuntarily move someone from their home. We've talked about that. We cannot provide services where there are no available resources. And that is an issue sometimes. Sharon can probably address the different issues. I know in Oklahoma, different areas had different resources between our metropolitan areas to our rural areas. And I know you have both of that. A lot of that in Hawaii. There is Honolulu, and then there's the East Shore. Okay, keep our country. And that's by the way, that's one of Mary and I's favorite places to go, is over on the east and northeast shore of Oahu. It's more like home for us. We cannot enforce the law, and we also, this is kind of just so you know, we can't reveal the identity of the reporter, and that can be a problem to a lot of people. Well, I need to know who reported this, and that might be someone who's just curious, like a neighbor or you or a family member or the client themselves. These are some things we cannot do. Okay.
So myth versus fact. So the myth is that referrals to APS usually result in nursing home placements.
You bet.
The fact is no.
No.
So,
What?
yeah.
I got that wrong.
So adults who have, so when they have decision-making capacity, they can live wherever they want. So this, this allows them to live in situations that, may vary greatly, maybe culturally or socially accepted by, accepted in certain standards. It might not be our standard, but it's theirs. So that's really their choice. This includes even putting up with the abusive behavior from a caregiver or allowing a family member to take advantage of them financially. Recommendations can be made, but in most instances, the APS professional, you can't provide any type of involuntary services. Even with client consents, only those cases which have really deteriorated to the point of requiring 24-hour medical supervision are referred for nursing home placements. Although there may be cases where an adult requests assistance for admission into maybe even a lower level facility. But yes, that's myth number one, that referrals to APS usually result in nursing placements. Not true.
Myth number two: AP professionals who investigate a referral can force both the victim and the perpetrator to do whatever we want, and whatever APS professionals deem necessary. And we probably harped on that too much, but AP professionals we can make referrals to law enforcement when they believe that a crime has been committed, but we don't have the authority, generally speaking, to force either the victim or the perpetrator to do anything. There may be some state-specific exceptions to this in some places, locations, but you've already seen the definitions for Hawaii. You can always go back and refer to those slides. Obviously, don't expect you to memorize all of this, but some of the situations where guardianships do occur are those situations where they are in danger to themselves or others. Sometimes that's a law enforcement involvement and mental health involvement combined, obviously, and serious medical conditions that require emergency intervention or other life-threatening situations, if the client does not understand. Now, if they are, for example, if they're unconscious on the side of the road or unconscious and they can't give consent or not consent, an ambulance, the medical professionals there in the ambulance aren't going to say, well, we don't know if they have consent or not, so we're not going to do anything. No, they're going to take them to the ER. Okay. So there are certain emergency medical situations that are beyond all of our control that sometimes do help. That's kind of a weird way of putting that, because they're probably in a really bad situation if that's the case. Sharon, myth number three, get me out of this one.
Okay, myth number three. When a referral is made, the main responsibility of the APS professional is to fix the situation to the reporter's satisfaction. Okay, so we appreciate getting referrals from all types of sources, but they can only provide those services the victim will accept. So this means that in some cases, the reporting party will not be happy with the outcome. And, we ask that the reporters continue to monitor the situation when, if possible, so that if, things further deteriorate, they can always make a second referral. Sometimes victims need the situation to get worse before they accept services. But, in any case, the victim is the person who decides what happens and not the reporter.
I love what you just said, Sharon, in that we can't, what she said was, sometimes we want that second report, that third report, that fourth report.
Exactly.
We do. We really do. And I don't know an exception to that across the country. We know that we would like to have another chance to visit with that person again and see if we can't use our skills and abilities to help them realize the seriousness of their circumstances. We would love to have that opportunity again. So if the self-neglect happens again, so, well, they didn't do anything last time, please do report. Well, they didn't listen to me last time. Yeah, we did. And I think that's what I tell a lot of new workers, that one of the calls that your supervisor feels, not all the time, but occasionally, is that, well, Paul didn't do anything. Otherwise, my mother would be in the nursing home right now. And our supervisors faced that because, well, I don't even think he even went out to the house because nothing happened, nothing changed. Sharon was talking about that we can't always facilitate change because the client has capacity. They have the right to self-determination. We talked about that at the very beginning. Safety and self-determination equally important. Self-determination will always win. So how to report.
Oh, yep. How we report. So this is the information for for all of you here in Hawaii. This is our reporting line. We are not 24/7 like Child Welfare Services. We are only open Monday through Friday, 7:45 to 4:30. We are closed and observe state and federal holidays. If you do call after hours, please leave a message. Phones are checked pretty frequently, so please leave a message and give us your contact number. And if anything, if there's any type of emergencies, whether it's even if you can't, if you're not able to reach anyone from the reporting line, and if there's an emergency, please call 911. The intake worker will likely ask you, in situations, especially in medical situations or urgent situations, if you did call 911 to address the issues that were happening with the person you're concerned about. So very important in emergency situation to please call 911 and then contact us. Our website. Oh, go ahead.
Or if you know one of the 3 law enforcement folks that are on the webinar today, just call them.
Yeah.
Kidding.
Our website does have our mandated reporter form. I'm assuming everyone here is our mandated reporters just based on the poll today. And our website also has a brochure with the different types of abuse, not just on self-neglect, but gives specific information on our agency and our program. So next was the resources.
So really the resources you have here, one of the sponsoring folks here is the Hawaii Aging and Disability Resources. You have voice and TTY numbers there. You have the website for Hawaii Aging and Disability Resources. And so that is definitely a resource we hope you will reach out to and learn more about the Aging and Disability Network there in Hawaii and what resources are available. It was one of the larger questions. One of the questions I saw quite often. And of course, Christina would love to hear from you. And so that is one resource. And Adult Texas Services is a resource. Not just Sharon, but anyone on any of the islands, whether it be Oahu, Kauai, Maui, wherever it may be, there are APS staff that are either there or can get there. The film resources, this is by no means all of the film resources that are available, but these are some from Terra Nova Films, who I have an affinity for. The first 2 you see bulleted there in red are self-neglect. What can I learn from the Mary Northern case? That was a case in Tennessee. And another video film is I Won't Go, looking at the situation that many of you brought up. What do we do when they won't go, when they won't accept help? How can we help those who don't want our help? The others here, if you look at them, are not about self-neglect. Elder abuse, 5 case studies, wonderful video. When help was there, one of my favorite videos, 4 stories of elder abuse. I'd Rather Be Home is a story about Norman. Last Will and Embezzlement, obviously, is a financial exploitation film. Serving the victims, more addressing some of the questions possibly and that you had in the chat about what resources might be available, how do we best serve a victim of elder abuse? And this is not just about self-neglect. This is about the many forms of abuse. Abuse, neglect, exploitation, sexual assault, financial exploitation. Then you have Fighting for Dignity. You have He Wouldn't Turn Me Loose. That is Miss Mary. It is a powerful story. 90-year-old grandmother and I won't tell you what the harm was by the grandson. But by the fact that I won't tell you makes you understand that it probably wasn't a good thing, okay? Facing diversity, responding to violence against women from diverse cultures, and what has age got to do with it is a really, really great video as well. This is just this is the tips of the iceberg, but I'm really glad that Christine and the crew located these and put these up there as a possible film resource for you. The background picture is Kualoa Ranch there on Oahu, by the way, just so you know.
And Paul, sorry, if we could just go back really quickly to the aging and disability resource. I know you mentioned several people asked, what are the type of services? One of the questions that I just saw on the chat was, what are the type of in-home services that can be provided? So, APS will probably contact Aging and Disability Resources, and what they try to do is try to assist both older adults, individuals with disabilities, and or their family caregivers to try to find options for services and supports. And these in-home type of services can include everything from meals, in-home meals, meal preparation, personal care services like bathing, grooming, dressing, and or even like assistance with cleaning the home, basic things with home cleaning. So those are the type of things that can be provided for the person in their home. And again, it does depend on, we all know there is a shortage with workers, but if it is available, please contact Hawaii Aging and Disability Resources Center, and they can try to see what options, what type of services are available for the person.
I want to mention that I know we have not just people from Hawaii, and I don't know what other states are represented, but I did notice one from Houston. And so that's Lindsay. So Lindsay, thank you for being on this call with us today. I will tell you this, Lindsay, that Adult TCS Services in Texas, they have an amazing program. They have for a long time had one of the best APS programs in the country. One of the first 3 countries that trained their staff with all the core competencies, and they've been doing that work that well for a very, very long time. So if you do want to reach out about resources and visit more about Adult Protective Services in Texas, please do reach out to your APS folks there in Texas. If you have any questions on who to reach out to, you'll have my email at the bottom of this, and you can email me and I can get you in contact with some of the folks I know in Texas if you don't know someone in Houston. Okay.
Thank you so much to everybody. We're moving into our Q&A section. So if you haven't already put in your question, you have a question you're just itching to ask Sharon or Paul, please put that into the Q&A.
Especially if we haven't addressed it sufficiently. We talked about some of it, but you might want to repeat your question if you want a little bit more clarification. We'll spend the rest of the time doing that. We've got another 12 minutes left, which is more than we thought we'd have. Your picture in front of you is the Nepali coast. They're on Kauai. That is Kalalau Beach, and I have had the pleasure of hiking into it and hiking above it and seeing it by helicopter and by boat. It just it's just one of the most amazing places on this planet. Is the Nepali coast in Kauai. It always makes me, it's just breathless. The pictures will not do it justice. All right, questions we have.
Yeah, so we do have a number of questions, but I'm going to go from the bottom up because I'm assuming some of the earlier questions were already answered because they were asked early on. Paul, you were asking about what people wanted to learn. So some of those questions are in there. So I'm going to go from the bottom up. There is a comment, that relates to services and resources that folks at APS, do face the same challenges in securing resources and services. Just the same as others, anyone else, that there is no specialized placement services that they have access to as APS that others don't. I think that's just a comment.
I see.
from
Yeah, that's
someone.
it. That's Megan's comment. Yeah, I see that.
Yeah, thanks, Megan.
Um,
Yeah.
Sharon, I'll let you handle that one.
I know. So I, here at, here in Hawaii, especially, and I think for a majority of, I think majority of APS programs nationwide, um, there's so very little services for the elderly. So when, for here in Hawaii, we have the City and County Elderly Affairs Division. This is usually our one-stop shop for services, so any type of chore, meal deliveries, those type of services. A lot of times we're also vying for those same services in the community as other agencies, and we're not prioritized. And looking even at our health plans, how the health plans can support in placement or in-home services. A lot of times if we're able to access any type of intervention, there is usually a long wait list, and we're often waiting for the same services. And unfortunately, for our elder population here in Hawaii, our services are very limited. So I think it's pretty common across the board.
Well, it's ironic that Megan, that it's adult protective services, and nowhere in any state in this country does APS own any of those services. They don't belong to us. They're community-based services. So that's part of the reasons why there's not always service available. I'm going to make just a anecdotal comment about Hawaii. There are certain things there that you might, well, some of it's not just about Hawaii. Like, for example, if there are cognitive issues, if it's related to Alzheimer's, go on the Alzheimer's website. Look what support groups are available. What services are available through the Alzheimer's Association. That they're extremely well funded. You have as you well know, you have a huge military presence and retired military presence, and don't be afraid to lean on your military resources there in Hawaii. I know from attending other conferences there and working with Hawaii APS that there are resources there that can help some individuals, some families. Obviously, that wouldn't apply to me or my family because we're not military. But that might be a resource. Anything like that trigger anything else you might think of, Sharon, that would be a generalized thing that they might be able to look for support there in Hawaii outside of APS.
Oh,
We've got an anonymous question here. Well, there's a couple questions here. There's one by anonymous, is can you address self-neglect in houseless individuals as well? This connects with a lot of issues discussed today, self-neglect criteria, when APS be able to get involved. I'll address the general situation with houseless individuals, and I speak to people a lot about that situation in Hawaii being pretty unique in many ways from where I live here in Oklahoma. Here's my experience. My experience is that because I have camped on the beaches of Hawaii, and I've loved that experience. Loved it. I spent a week in Kauai, 5 days on Salt Pond, and 2 or 3 other days elsewhere in other parts of the island, camping on the beaches. In my experience, I've met a number of people. So Hawaii has the same homeless population or houseless population that we do in Oklahoma. You have those who, some of them are dealing with mental illness, and also possibly drug issues, or both. And that's the stigma. But that in and of itself doesn't mean they can't get help. But you also have individuals in every state that are just homeless. They can't afford housing. Hawaii housing is a little bit high. I don't know if you know that or not, but it is. And I have met a number of individuals, families who live on the beaches with their families. Mom and dad go to work every day. Kids go to school. They come back to the beach, and that's where they live. But the houseless population that I think Anonymous is talking about, or that was talking about, is about those. How do we help those who aren't working, aren't going to school? And it's tough. It's a really hard population to reach. It's a hard population to reach out to. You had the dire example of that Sharon gave you of the houseless individual. It's a difficult population to work with, and it's not their fault that they're difficult to work with. It just is. Their circumstances are very, very difficult. What's the next question? Maybe you want to address the houseless situation and what efforts are being made in Hawaii. I will say this: since COVID, the drug usage population of the houseless in Hawaii on the beaches has gone through the roof. It is no longer safe for me to camp on the beaches of Hawaii. That was what my friends told me last year when I wanted to. Says, no, Paul, no, Paul, no, Paul, you'll stay with us. Oh, but I want to camp. Oh, no, Paul, no, Paul. I grew up there, Paul. No. So, Sharon?
Yeah, Lindsay had asked, can we bring lack of resources to the legislature to fund APS to create our own much needed resources owned by APS? Oh man, we just came out of a legislative session. Christina, maybe you can kind of talk about things that Office on Aging or Office of Aging want to chime in on things that are happening with the resources as far as our
And I'll tell you one thing that could or should be advocated for would be emergency funds.
Yes.
In the hands of Adult Protective Services, so they can deal with immediate emergencies, housing, food, shelter. I mean, in the case of in Oklahoma, they need firewood. Emergency funds to pay for emergency things this month, and then deal with the long term and with some other issue.
I did just list on the side, and I saw in the chat as well, just a resource from the governor's office on homelessness, and it lists, several of the just different areas and where to kind of programs that work with houseless individuals and families. And then Diane Lim Tam listed some services for veterans as well.
Well, guys, you guys have great questions. I'll tell you what, and we're not going to get to all of these. We have another 2 minutes left. So what we're going to do is capture the chat, and I think, Christine, if I'm right, the names that are on the chat, you have an equivalent email. So am I correct? I hope.
I think
Yeah, I think we can post all the questions and do like a Q&A doc and make sure everybody has access to that.
Okay.
Thanks, Christina. Christy, thank you.
So Christy, you want to close this out? I mean, because I want to answer the one about decision capacity spectrum. What evaluation do folks do?
Yeah, why don't
I'd love to answer that.
I think a lot of people might have that question. So why don't you answer that and then we can close out?
Yeah, we don't have the time, and that's a great question.
Okay.
Approved psychiatrists, physicians, probably not. We can't, but we'll do our best to answer these. So Christy, you want to give them the what and where's for us as far as after this, and how they can post their questions if they're not on chat or Q&A, and how that'll be addressed, and any evaluation or whatever you do. Okay.
Yeah, I'll have Lindsay do that. Thanks, Lindsay.
Okay, Lindsay. Okay.
Thank you, everyone. And I think there's a little bit of a mix up with the link earlier. So if your name is not, there's a couple of Lindsays on the line. So if your name was not reflective of what your name is, go ahead and email me and we can get that sorted out. Again, my name is Lindsay at highfi.org, but I'll send that out in the follow-up email. In addition to the link to complete your evaluation, which again needs to be completed by end of day, Wednesday, June 21st. We do have the chat box and chat saved. And so we'll be doing some Q&A. We'll put it in a Google Drive and make sure everybody has access to that. So keep a lookout for some updates to the Google Doc. Certificates for CEs will be emailed to you by close of business on Friday, June 30th. And that will conclude today's webinar. Again, I wish we had more time to go through it. It's such an important issue, but just want to mahalo all of you folks for everything that you do to Malamara Kupuna. Hope you join us at a future training. And thank you for your time today. Aloha and take care.
Thank you, Lindsay.
Thank
Mahalo
y'all
to
so
you
much.
too.
Mahalo, you guys. What a
Stay
pleasure to
safe,
be.
Paul.
Yes, ma'am. Hey, we got all the power back here at the
I
church, and I
know.
heard